Welcome back to my channel. It's Priscilla again, and this video is a very informative and educative one. I hope you find value from it. I want to sincerely appreciate all those that are subscribed to my channel. I see your love and I am deeply grateful to you. And I urge you to watching me right now if you haven't subscribed. What are you waiting for? This channel is a growing channel and I need your subscription to fly. I am dedicated to dishing out this educative and informative content, and I promise you are going to love it here. Please consider subscribing to the channel, like the videos, and share. Share so that YouTube can bring it out there for so many people to see. If you are a woman, this video is for you. Whether you're already a mom or you are expecting, whether you are married or yet to be married, I believe that one day you will get married and you will also be a mom. It is very important that you watch this video because what I want to talk about here is something very important, but yet most mothers are ignorant of it. And what is that thing I want to talk about? It is aspiration in babies. What is aspiration in babies? This is when where the food and liquid, the water the baby has already consumed, accidentally goes back to the lungs and to the airways. When this happens, it can cause severe complications and it can even lead to death. Aspiration, as simple as it sounds, has killed a lot of babies. It has caused severe complications to a lot of babies. And not because their mothers are careless, but because most of them are not informed. They don't just know about it. And that is why you need to share this video so that every woman will get to know this. I have been in this profession for more than a decade. And believe me when I say I have wealth of experience, both personal experience and on the job experience. I have seen cases. And that is why whenever I come here to share something with you, I make sure I give you real life scenario so that you will understand the reality of what I'm talking about. Now, before I proceed, let me share this pathetic experience I had some time ago. On this fateful night, I was on duty, and at about 11:12 p.m., a baby was rushed in, a 3-month-old male baby. That baby was very chubby, very good looking, but the baby was BID, meaning he was brought in dead. Now, what happened? It was on a Saturday night. Now, on Sunday was supposed to be the baby's dedication. So there was a lot of activities going on. Women were cooking, friends were there. There was merriment everywhere. Now, what actually happened to this baby? According to the mother, she breastfed the child, and when she was done, she laid the child down on the bed and asked the father to please put an eye on the child while she goes downstairs to check on the women that were cooking for the next day's occasion. And I guess she spent a lot of time probably downstairs. And by the time she came back to the room, she saw that all the breast milk the baby has taken, they were all out through the nose, and baby was no longer breathing. And so they rushed the baby. Meanwhile, the father was already sleeping. He fell asleep. So he didn't even know what was going on. So the mother had to alert the husband, and they rushed the baby. But unfortunately, before they got to the hospital, baby was already cold. The baby was gone. We did everything we could. We ambo-bagged oxygen. We took turns to ambo-bag that child. even staffs that were not medical staffs, security, they learned how to back that day. We spent time, we did everything we could to see if this baby will breathe, if he will come back to life, but it was already late. I felt for that woman. She was so good looking. She made her hair, fixed her nails, ready for the occasion. And then this happened. This is not something any mother should experience. If only she had known, she would have just done a little more things. She would have just been patient to make sure that baby was fine and ready to be laid down. She would have just taken some few steps before going downstairs, and this wouldn't have happened. Like I mentioned earlier, aspiration in babies occur when food and liquid which the baby has already consumed accidentally enters the airways, that is, it returns and enters the airways and the lungs. It can be caused by swallowing difficulties, also known as dysphagia. It can be caused by acid reflux diseases. It can also be caused by structural abnormalities, meaning that the baby was just born with it. Also, it can occur as a result of how the baby is being positioned during and after feeding. And that takes me back to this story I just told you. If that woman was patient enough to see to it that that child belches, if she had just cuddled that child, give the child some pats on the back and make sure that child belches, that incident wouldn't have occurred. Also, if she has laid the child down properly, by elevating the head, tilting the head upward, even when the aspiration occurred, it wouldn't have been that bad that it will now come out. When aspiration occurs, those food particles, what it does is to obstruct the airways so that oxygen cannot go in. And the baby will now start struggling for oxygen. And if there is no prompt response, if there is no immediate attention given, that baby can die before you know it. When food particles enters the lung, it can damage certain tissues in the lungs. Also, aspiration increases the risk of pneumonia in babies, which is a disease condition whereby fluid is being piled up, is being built up in the lungs, and the child will have breathing difficulties. Now, let's talk about certain things you can do to avoid aspiration. If you want to feed your baby, position your baby properly. Some mothers are very careless when it comes to this. You want to breastfeed your baby, you are breastfeeding your baby and you are pressing your phone at the same time. You are not concentrating and making sure that that baby is okay. I have seen a mother breastfeeding her child and the child head was like this. It was tilt down. Instead of you to use your arm to elevate the head of your child and make sure the head is higher than the body a little bit. That is why you have to support the child's head with your arm. Please, mothers, don't feed your baby and press your phone at the same time. If you want to breastfeed your baby, breastfeed your baby. Make sure that baby is fine. The phone can wait. Whatever you want to do with the phone, you can do it afterwards. Secondly, some mothers, they breastfeed their babies while sleeping. My dear, you might be lucky not to have had any ugly experience, but I'm telling you, that singular thing, that singular act has cost most mothers their children. You can't be lying down and breastfeeding your child at the same time. Please, I am begging you, my dear mother, if you are breastfeeding your child, especially in the night, I know after a long day you might be tired, but no matter how tired you are, make sure you sit down on your bed. Grab a pillow, put it under your hand, under your arm, and make sure that that baby's head is elevated. Please try to be awake when you are breastfeeding your child. Another thing is always support your child while breastfeeding. Support the child, hold the breast with the other hand. That is why your two hands must be busy with your baby. You cannot be pressing your phone, and because the weight, especially when your baby is very small, the weight of your breast is bigger, or is more than the force of your child. The force is going to suck, so he's not able to grab it. You have to assist the child so that your breast does not cover the nursery of the child while you are breastfeeding, whereas you are busy pressing your phone or being distracted with something else. Please, mothers, let's be guided. Another point I want to make here is that if after breastfeeding your child, please see to it that that child belches. Be patient enough to carry your child in an upright position. Pat the child at the back. Do that until you hear that child belch before you can lay that child down. And even at that, when you lay the child down, please make sure to elevate the head of that child. You know, all my children, I used pillows for them. I don't miss it because I have seen cases. So I didn't take chances at all. I remember when I had my first child, a woman came to visit me, and he saw my child lying down with pillow, elevating the head of the child. And he said, why are you putting pillow under the child's head? It's going to scrape the child's hair. So you will now have hair at the back. In my mind, I said, is it not only hair? Let it scrape. When the time comes from the head to come back, it will come back. But I knew what I was avoiding. Please don't just lay your child like that. Look for a soft pillow. Elevate the head of that child, because you wouldn't know when aspiration will occur. Then try to feed your baby a little at a time. Most babies, they just want to empty the breast. They want to eat everything. Even when you are bottle feeding, feed a little at a time. Most times you don't feed the child based on how they demand it, because they don't know their gauge. If you overfeed them, they can easily aspirate. Then lastly, feed your baby slowly. This applies to mothers who bottle feed. If you are feeding your child with a feeding bottle, please pay attention to the should I call it the tip now, or the supposed nipple of that child, the hole where that of that bottle, the hole where that bottle is, the food is coming from. Make sure it is not wider than what it should be. Make sure that it is thin enough to supply the quantity of food that that child wants at that stage. So as the child grows, you can now widen the mouth of the feeder. Stay tuned for the continuation of this video. If you are watching me and you haven't subscribed up till now, please do well to hit that subscribe button. Turn on the notification bell so that whenever I dish out this kind of informative content, you'll be the first to get notified. Also, don't forget to like and share.